This is Jodi Julien, and I am a DNP student at Maryville University, and this is a presentation on my final project, which is increasing the number of blood draws performed on admission. This project consists of 5 different chapters completed throughout the different semesters. My DNP chair is Dr. Snell, and my community chair is Dr. Ahmad. Chapter 1 was the phenomenon of interest. Venipuncture, which is entering a vein with a needle, is a procedure that is one of the most completed invasive procedures performed in the healthcare setting. Performing venipuncture is an essential psychomotor skill that requires academic competence, confidence, and proper dexterity. This procedure can be terrifying for new nurses or nurses who lack the proper training and confidence. For many nurses, nursing school is the first time they are exposed to performing venipuncture. The nursing student begins to learn the technique and may have the opportunity during their clinical rotations to perform venipuncture. For other nurses, they may infrequently get the opportunity to perform venipuncture while in school and are required to learn the skill during their first job. The PICO question is, in patients admitted to the Substance Abuse Detoxification Center, will implementing a new blood draw in comparison with the current blood draw protocol that is currently utilized increase blood draw upon admission over 6 months? The current policy where this DNP student is employed states that upon admission to the Drug and Alcohol Detox Center, every patient will have their blood drawn, although this is not always completed. The bloods that are typically drawn upon admission are the complete blood count, vitamin D, the CMP, quantiferum gold, the rapid plasmic regain test, and the hepatitis profile. There are issues with the current protocol. For one, there is no actual tracking except to write a patient's name in a 3-ring binder. That being said, the patient's name does not always get added to the 3-ring binder. Therefore, the next shift does not know that the blood needs to be drawn. There is also a lack in the fact that not every nurse draws blood. Some of the nurses just don't want to draw blood. Some of the nurses don't know how to draw blood. And some of the nurses lack the confidence and ability. The interest level for this project is as a result of patients not always having their blood drawn on admission, which causes a delay in lab work results. And this also creates the possibility of having a delay in treatment. The purpose of this project is to increase the number of blood draws upon admission, which will in turn increase the confidence level of the nurses. The aim is to review the number of venipunctures on admission, review confidence level of the nurses, review the evidence-based practice, and then implement a new protocol. The scholarly project incorporated a quality improvement project that evaluated the efficacy of implementing a new initial blood draw program versus the blood draw protocol that is currently in place. A pamphlet was provided to each nurse that illustrates the proper procedures in performing venipuncture. This DNP student then provided written, oral, and demonstrative education to the nurses about proper procedures in venipuncture. The nurses had 3 months to increase their skills and knowledge. The methodology of this project was 77 charts were reviewed pre-intervention. There was a 3-month educational period. And then there were 77 charts reviewed post-intervention. When a patient is admitted to the Substance Abuse Detoxification Center, they are at an increased risk of having a virus or other health issue. Alcohol use is a major factor contributing to disease and injury, while intravenous drug use has been linked to being the primary risk cause of hepatitis C and other illnesses. The benefit of project to practice. This increased the confidence in the nurses, resulting in an increase in the number of blood work drawn upon admission. Chapter 2 was a literature synthesis. Patients who abuse drugs and alcohol are at higher risk for developing diseases such as hepatitis, syphilis, cirrhosis, infections, cardiovascular disease, cancer, HIV, AIDS, hepatitis B and C, and lung disease. Therefore, it is imperative that each person who presents for admission at the Substance Abuse Detoxification Center must have their blood drawn as soon as possible. Unfortunately, not every nurse completes this task for each patient as they are admitted. Several nurses do not understand the urgency, while others do not know how to perform venipuncture. It is imperative to get blood work completed on admission in order to provide prompt and effective treatment. When there is a breakdown in the system, there is a delay in obtaining blood work, which could result in a delay in treatment. During the search history, the keywords that were used were alcoholism, drug abuse, venipuncture, liver disease, hepatitis, and nurse confidence. Before exclusion, there were 180 articles. After exclusion, there were 102 articles, and there were 36 articles that were selected. The three themes that were found were drug and alcohol abuse, education and training in drawing blood, and nurses' confidence in drawing blood. Many people in the United States suffer from substance abuse disorder with increased usage in the last several decades. Although substance abuse includes opiates, benzos, alcohol, marijuana, amphetamines, and other substances that alter the body, substance use disorders will be limited to opiate and alcohol use for this project. The use of opiates have been linked to severe infections, overdose, suicide, GI disease, cardiovascular diseases, and trauma. For alcohol use, it's cardiovascular system, brain, liver, immune system, and cancer may develop. Many of the nurses who begin working in substance abuse are not familiar with the correct procedures of drawing blood and need the education and training to correctly perform the procedure. Although education and training of skills required for nurses begin during nursing school, it is uncommon for peripheral venipuncture to be included in the skill checklist and be part of the formal education. Needle stick injuries are an all too real occurrence that happen while performing venipuncture. For this reason, the first step in drawing blood is choosing the right equipment, which includes the device to extract the blood, the tourniquet, the antiseptic, and the appropriate tubes. Having the proper education and confidence in drawing blood will reduce the nurse's risk of experiencing a needle stick injury. Along with preventing injury to oneself or the patient, the nurse must also understand the proper blood drawing technique. Hemolysis, which is when the red blood cell membrane ruptures and hemoglobin and other intracellular components combine with surrounding plasma, is one of the most common causes of pre-analytical errors. Drawing blood too quickly through a syringe versus a vacuum tube can cause the red blood cells to burst, causing hemolysis. When hemolysis occurs, it creates the need to redraw the blood, which could delay treatment for the patient and increase in medical expenses. Therefore, it is recommended that a butterfly needle be used to collect blood to reduce hemolysis. Educating nurses on proper blood draw procedures will decrease in vitro hemolysis. It is critical to teach appropriate use of a tourniquet. The tourniquet, when placed, should not be left on for more than 60 seconds. Leaving the tourniquet on for more than 60 seconds will change the blood composition. And when this is done, the correct lab results will not be established. You also have to draw blood in the right order. Confidence in performing any skill develops over time and improves the more the skill is performed. Nursing students who studied in an organized and systemic way have higher self-confidence and self-efficacy. By studying and developing a routine of performing venipuncture, the nurse or nursing student can develop a higher confidence. It is important for the nurse or nursing student to physically practice performing venipunctures. Practicing venipunctures on peers can be beneficial to the nurse learning to draw blood. When a nurse or nursing student have proper training, perform their first venipuncture on their peers, and practice the technique, they had higher self-confidence and self-efficacy. During the literature review, one of the strengths of the literature review was that there was ample information on the effects of drugs and alcohol and the proper techniques of drawing blood. Some of the weaknesses were that there were minimal information on the confidence level of nurses. The relationship of confidence in nursing and their ability to draw blood is extremely limited in the literature. Nurses are often left to learn venipuncture on their own after they complete nursing school. Depending on their on-the-job training, they may not have much training after nursing school either. It is essential to understand the relationship of practicing venipuncture and how it affects the nurse's confidence level. Substance abuse is the use of drugs or alcohol with no medical reason. In order to be diagnosed with alcohol use disorder, you must meet 3 of the 7 conditions: tolerance, withdrawal, increased amounts over time, ineffective efforts to reduce use, interference with personal or professional life, and significant amount of time obtaining and using. For an opiate use disorder diagnosis, you have to have 2 of the 12 conditions in a 12-month period. The amount has increased, the inability to cut down, excessive time spent on drug, use of opioid, strong desire to use, continued use despite interpersonal and social problems, decrease in regular activities, using in physical hazardous situations, continued use despite physical or psychological patterns, need for increased amount, and withdrawal. Kurt Lewin developed the change theory, which occurs in 3 stages: unfreezing, change, and refreezing. He believed that our behavior, beginning in childhood, is molded by every aspect of our social situation. The first step is the unfreezing stage, is to identify the problem and implement a protocol that establishes that blood work is obtained during the admission process. The nurses were then educated on the importance of obtaining blood during the admission process and not waiting several days to complete the blood draw or not obtain it at all. The second stage of moving is when the change occurs. During this stage, the nurses were required to obtain the initial blood work on admission. If there were still nurses who were not comfortable drawing blood, a mentor was set up to assist them until they were comfortable. If the nurse had attempted to draw the blood and was still unsuccessful, they had to inform the director of nursing and the blood was not obtained and why. The third and final stage is refreezing. This occurs when the habit is adopted and institutionalized. During this stage, the nurses formed a new habit of drawing blood on admission. The director of nursing still needed to conduct audits at this stage, although most nurses completed the blood draw. There will always be some patients that the nurse cannot obtain blood from due to dehydration or overuse of veins due to IV drug use. Chapter 3 is methods. A quantitative retrospective chart review was utilized for this project that does not engage participants. Data was collected from de-identified charts located in the electronic health record. Minimal necessary data was extracted to accomplish the goals of this project on the data collection sheet. This research student determined if implementing a blood draw protocol and providing education on the nursing staff increased the number of blood draws upon admission. There are numerous comorbidities related to opiates and alcohol use. Given the number of blood draws upon admission, a needs assessment was performed to emphasize the necessity of drawing blood on every patient when admitted to the detoxification center. The Chief Operational Officer and Directors of Nursing at the 3 facilities respectively endorsed this study. They believed the nurses would benefit from participating. The design occurred in 3 different locations, 2 in Florida and 1 in Massachusetts. The patients were all between the ages of 18 to 89 with a diagnosis of alcohol use disorder, opiate use disorder, or both. There were 77 pre-intervention charts and 77 post-intervention charts. The inclusion criteria is that the patients were between the ages of 18 to 89. They had a diagnosis of alcohol use disorder, opiate use disorder, or both. And the patient was admitted between October 1st, 2020 to June 30th, 2021. The exclusion criteria is that the patients under 18 or over 89, that there was no documentation of alcohol or opiate use disorder, and that they had no admissions within the last 30 days. There was no recruitment of patients as this was a retrospective chart review. There was a data collection tool. The data collection sheet was coded with 1, 2, 3, and 4. The diagnoses were 1 for alcohol, 2 for opiates, 3 for both. The other data was 1 is yes, 2 is no, 3 is attempted, and 4 patient refused. Reliability and validity are important factors when creating, developing, and writing up results in quantitative research. Reliability is achieved when the test can be repeated with consistent results, while validity is making sure there is accuracy of the measure. The confidence level is at 95%, resulting in a true change in ratio from pre to post intervention. The Z-score method was completed using 77 pre-intervention charts and the 77 post-intervention charts. The financial expenses were minimal to the researcher. The researcher had a computer that was used for data collection. The researcher assumed the cost of transportation of $182.60, electricity of $21.60, and printing of report $13. The total amount spent was $217.20. There was no anticipated risk to the subjects in this retrospective electronic health review beyond the minimal risk of confidentiality breach. The electronic health records were assigned a numerical number on the data collection sheet with all the identifiers removed. The data collection sheet was stored on a password-protected computer. The author of the scholarly project was the only person that had access to the password-protected computer. There was no printing of any documents, reducing the risk of breach of information. The data analysis included an Excel worksheet and the SPSS program where the Z-score test was completed, an analysis where there was a pre-analysis phase, which included various clerical and administrative tasks, and a principal analysis, which is where the statistical analysis to the test was hypothesized. Chapter 4, Data Analysis and Research Findings. The instruments used in this project were data collection sheets. The procedures were education that was provided to the nurses. The reliability was that there was a 90% confidence level, resulting in a true change in ratio, and the validity was a p-value of 0.9865, which is a difference in the measure of the two groups. The ethical aspects. There was approval from the IRB board. The data collected was from de-identified charts. There was no formed relationship with the patients. Minimal data was collected, and the data collection sheets were stored on a password-protected computer. The steps of the intervention were the project preparation in March of 2020, the site and IRB approval, which was December 2020, data collection, which is October through December, data analysis, which was April 2021, and summary report, which was August 2021. Here it shows the blood work that was drawn post-intervention versus pre-intervention. As you can see, the number of blood work post-intervention is greater than pre-intervention. Unintended consequences of this project is that patients were more confident and comfortable when it comes to the nurses drawing their blood. There was no missing data. The data collection was maximized, and all pertinent variables were represented. Chapter 5, Implications and Conclusions. There were limitations with the scholarly project. First, there is a lack of prior research on the topic. Secondly, there was a turnover with some of the nurses. There were nurses who resigned and new nurses replacing them. Thirdly, the retrospective chart reviews were conducted on different patients. Although there were 77 patient charts reviewed during the pre-intervention and 77 charts reviewed during the post-intervention phase, the patients did differ as far as sex, age, and diagnosis. COVID-19 did impact the scholarly project because it increased the number of hours and shifts worked by the nurses, which increased burnout and fatigue. When the nurses were tired, they seemed to not want to draw blood as much. And it also increased the number of admissions due to the number of patients who relapsed due to losing their jobs and other impacts from COVID-19. The interpretation of this project is is that it's necessary to educate and train the nurses. We need to have proper education that leads to an increased number of blood draws. And expected outcome is that nurses can draw blood on every patient successfully. The implications are that we need future research that needs to focus on the confidence level in nurses. There needs to be a strong link between nurses' confidence level and their ability to draw blood, and safety is crucial when drawing blood. Recommendations are that nurses conduct a self-evaluation and that nurses learn and understand the importance of timely blood draw. The conclusion is that the DNP project demonstrated that implementing an education and training program increased the number of blood work that was drawn upon admission. And here are the references.